Welcome to AETCM, the emergency medicine channel. Today let us discuss about one of the important zoonotic disorder, that is rabies. Rabies is a neurotropic virus. That means it has got a attraction towards nervous cells, and when it enters to our body, it directly go to central nervous system and creates features like encephalopathy, altered behavior, seizure, brain cell dysfunction, all these things. It's coming under family Rhabdoviridae, genus Lysavirus, subgroup Rabies virus. That's a family detail of this virus. It's one of the important neglected tropical disease, and most of the time it occurs in third world countries because rabid dogs or rabid dog bites, rabid animal bites are very common in these third world countries. That's why it is a neglected tropical disease. Most of the time this rabies, that virus, is transmitted from dogs. Domestic dogs are main carriers of this virus and spreading disease to human beings. But there are other carriers also. Cats can be there, raccoons can be there, bats can be there, foxes can be there. So many animals also can carry rabies virus. But in human being, the most important source of this disease, spreading source of this disease, is domestic dogs. So reservoirs are dogs, foxes, raccoons, owls, bats, etc. So in human being, it mainly spread through the bites through rabid dog or rabid cat. Bat or foxes also can spread this disease to human being, but it is rare. The virus enters from the oral cavity through the saliva. It will enter to the bite site and replicates there. From there, it travels through the peripheral sensory nerves and go to the central nervous system, that is the spinal cord. Then it reaches the brain. That is the root of this virus infection. So in CNS, it has got peculiar findings. Once you, like if a rabid dog's brain, you take a biopsy from that and see in the brain cells, you can see a peculiar cytoplasmic inoculations. They are called as Negri bodies. That's how we diagnose rabies in rabid animals. After death, if you want to diagnose, if you want to confirm the diagnosis, this is one of the important and easiest method to diagnose rabies. Inoculation period is usually 1 to 3 months. That is a problem in rabies. Normally, in many other viral infections, it can come in. It can produce clinical findings in 7 to 14 days. But rabies can have a prolonged incubation period. But most of the time, it comes less than 2 weeks. But rarely, if the patient has got a bite on the face or ears where there are a lot of neurons which directly travels to the brain, and the spread can be even faster than that. Even within 4 hours, the virus can reach to the brain if there is a facial bite. So we have to be very careful when we are treating this type of bites. Now, there are different stages for rabies. There will be a prodromal state for rabies. Like any other viral fever, they can have high degree fever, headache, weakness, anorexia, vomiting, paresthesia around bite site. And then in that, again, you have 3 different areas in prodromal state. Once it is over, then acute phase of the illness come. In that, we have 3 important different areas or different subclassification. One is acute encephalitic stage. It is something like any other viral encephalitis. Patient can have agitation, confusion, seizures, focal neurological deficits, coma, and many patients can have a lucid interval. That means during the acute, patient can have altered behavior, abnormal like GCS and all, and they may even lose their consciousness. GCS can be very low. but after sometimes they will become completely normal. This period is called as lucid interval. So in that lucid interval they will have severe anxiety and fear of death. Then the patient may develop brainstem dysfunction. They can have complete paralysis of both the upper limb, lower limb. They can have diplopia, optic neuritis, cranial nerve palsies, and during this period patient can have photophobia and hydrophobia or aerophobia. All these things can be there in patients. Now ultimately it will lead to death. Death is inevitable in most of the rabies cases because there is no permanent cure for rabies. Most of these patients succumb to death after 1 or 2 weeks. Dumb rabies is a type of rabies where the patient develops acute flaccid weakness. It is mainly occurs in vampire bite, not very common in our country, but it is common in European countries. Hydrophobia Aerophobia. These are the two important clinical findings you can see in rabies. They have severe laryngospasm when they try to take water initially, and afterwards when they see the water itself they develop severe laryngospasm and pain. So the phobia is to water. So initially water will produce laryngospasm. Water intake will produce laryngospasm. Later when they see the water itself they develop severe spasm in the laryngeal muscles and they can have severe pain in the throat. Aerophobia is also there. Many patients, even the air coming from the fan itself will produce severe disturbances that itself can produce phobia in them. So hydrophobia, aerophobia, some patients can have photophobia also. That's why we keep the patient in rabies cell because rabies cell means there will not be any light, fan, water, nothing will be there. Patient will be in a room, it will be completely quiet room. Like tetanus, here also we have to keep the patient in a very quiet room. Otherwise patient, each and every small trigger, patient will be highly irritable and they will be having agitation, seizures, all these things even with a small trigger itself. Now outcome is very, very bad in rabies. So most of the patients may develop severe neurological dysfunction in 1 to 2 weeks. They have brainstem syndromes, complete paralysis. Later erased ICP can occur. Slowly brain conning can occur. And most of the patients will die in maximum 2 to 3 weeks. So the outcome of rabies is very, very bad. There are differential diagnoses because any patient who have a dog bite or cat bite in previous 1 or 2 weeks, even if they come with any other disorder, the doctor may have a differential diagnosis of rabies. So these same patients can have so many other diseases during that period. So these are the differential diagnoses. We should differentiate rabies from all these things. Intracranial mass lesions, epilepsy, atropine poisoning with atropine-like compounds, pseudohydrophobia, that is hysterical after dog bite or cat bite. They believe that they have developed rabies and they have developed all complications or malingering or complications like rabies, but it is not. It is only a psychological problem. Other infections of brain like encephalitis, meningitis, Guillain-Barré syndrome, botulism, tetanus, transverse myelitis, CVA, psychosis, all these things can mimic rabies during that interval from the bite to immediately after bite or 1 or 2 weeks. Many patients have this psychological problem. They come with the rabies-like features to emergency room. So it's the duty of ER physician or physician on duty to diagnose rabies, or differential diagnosis are very, very important. Unlike other conditions, differential diagnosis in rabies is very important. Now there are limited investigations in acute phase of rabies because unnecessarily investigations will provoke the patient and it will trigger laryngospasm or all muscles will be developing spasm during acute phase. So it is better to avoid many investigation during rabies. However, there are some investigations can tell you about the diagnosis. One is CSF finding. You can see elevated WBC cells and elevated proteins. Cells will be predominantly lymphocytic, like lymphocytic reaction. MRI brain can be done in patients who have DEM rabies, or patient is under sedatives. So without sedatives, we will not be able to take any MRI in this patient because they will be highly agitating, and it will be a risk for the healthcare person to take these patients for various investigations. Now, suturing, if there is a large wound which is bleeding, we can suture. Otherwise, better to avoid suturing in smaller wounds. The wound should be cleaned properly. That is very important, because suturing is not that important in rabies. You can keep the wound open. You can clean it thoroughly with whatever solution available on that area has to be taken and clean the wound properly. We can use soap water. That is the best solution in any site other than hospital. Primary site itself, we can get any soap water and clean the wound properly. If a patient come to an hospital, immediately we can use povidone iodine solution. So local wound cleaning with soap and water is the first and foremost important thing in prevention of rabies. If you don't do that, there will be inoculation of virus to local sites, and from there it can easily spread to your central nervous system. So washing the wound is the best way to prevent rabies. Then we can use povidone iodine solution for washing inside hospital. Try to open the wound, and if there is a massive wound or if there is a bleeding wound, then try to suture it just to prevent some contamination or preventing the bleeding. That's all required. TT has to be given for all bites, whether it is human bite, cat bite, rat bite, dog bite. Everywhere we have to give tetanus toxoid injection. Antibiotics if needed. Antibiotics is not important in all these bites, but sometimes these bites are very large, then they can have infection secondary to anaerobic bacteria. So antibiotics can be given: crystalline penicillin, amoxicillin, augmentin, azithromycin, anything will do. Now next one is anti-rabies immunoglobulin. Rabies post-exposure prophylaxis is an urgent treatment protocol, because especially when there is a proximal bite, if there is a bite on the face, neck or ears, it is better to give the anti-rabies immunoglobulin as fast as possible. Human rabies immunoglobulin HRIG 20 international units per kg should be given for all patients who is having severe bite or unprovoked bite, or if you don't know about the immunization like immunization data of the dog, better to give this human rabies immunoglobulin. 20 international units per kg is for human immunoglobulin, and 40 international units per kg for equine immunoglobulin. So there is a slight difference in dose of equine and human immunoglobulin. So it gives immediate protection against this virus, so it has to be given, and the maximum dose should be infiltrated around the wound. That is very important. All the whatever available dose is should be infiltrated around the wound. If the wound is very small, rest of the thing you can give in a IM route, can be given distant to vaccination site. So if suppose you are giving vaccination at one site, there we should not give the immunoglobulin. That's all. It can neutralize the vaccine, so that should not be given. Another drug is monoclonal antibody against rabies. The brand name is Rabies Shield. That can be given. The recommended dose for Rabies Shield is 3.33 international units per kg body weight. It is available in 100 international units in 2.5 ml. 40 international units per ml vial also available. So that has to be given in a dose of 3.33 international unit per kg body weight. So that can be given instead of immunoglobulin if it is not available. Now next one is active immunization process that can be given as pre-exposure prophylaxis or post-exposure prophylaxis. So pre-exposure prophylaxis, those who are working in the veterinary field or if you are handling dogs and all, you have to take a pre-exposure prophylaxis. But post-exposure prophylaxis means after getting a bite, post-exposure prophylaxis along with human rabies immunoglobulin has to be given. We'll see what is the dose of these things. Pre-exposure prophylaxis, first dose 0, second dose 7, third dose 21 days can be given. So that is primary immunization regime. Booster doses are generally recommended every 2 to 5 years. That is very important. So that can be given in persons who are working in the field of veterinary field or patients who are handling pets. Post-exposure prophylaxis should be taken in any patient who had dog bite or cat bite, whatever it is. The dose is 0. The 0 means at the day of office visit, 0, 3, after 3 days, 7 days, 14 days, 30 days and 90 days. It should be given only deltoid or outer aspect of the thigh in young children. So that has to be given in patients who is exposed to any bite. So depending on the severity of bite, depending on the immunization status of the dog, or if we are not able to track the dog, whatever it is, then we will have to give human rabies immunoglobulin along with this post-exposure prophylaxis. There are different brands available in our country for vaccines. So these are the vaccine list. You can, whichever brand is available in your place, you can select it. But remember, if you are giving one brand as first dose, it is always better to continue the same brand throughout the course. Till 90 days, we have to give the same companies or same brand of vaccine. That is the best. That will give best result. So according to WHO category, there are different categories for which can give rabies vaccine, or which can decide whether rabies vaccine is required or not. But however, whatever recommendations are given by WHO, it will be very difficult to predict the course of rabies in any patient, because even immunized dogs or immunized animals sometimes can spread the disease, or even a small lick or bite can spread the rabies sometimes. So it is always better to give the rabies vaccine at least in patients who have minor injuries, and major injuries it is better to give human rabies immunoglobulin with vaccine. But WHO has given categories for post-exposure prophylaxis. It is better to read it for theoretical purpose. So we have discussed about one of the important zoonotic preventive infection. That is very important. It is a preventive infection. If we know about the vaccination protocol properly, we can prevent this disease. And one more important thing is all hospitals or all healthcare facilities, we have to maintain the cold chain of the vaccine. That is very, very important. When we are managing the vaccine, we can see some patients, even after taking vaccine, they develop some diseases. That is because many a times the vaccine cold chain is not maintained properly. So as hospital, we have to take care that cold chain, whether the cold chain is maintained properly or not. As doctors who are working in emergency room, they must know about the vaccination schedule, vaccination protocol. All these things are very important to prevent this deadly zoonotic infection, because once the patient develops rabies, there is no major treatment available for this disease. Very, very rarely only patient survive after a rabies infection. Thank you.